Trauma care starts in the streets. It starts with our emergency medical personnel. They initially see the patients, they realize they meet certain predetermined criteria, and then they call a trauma activation. The emergency medicine team here is alerted. They send out a page so that we gather all of our resources here. We have 3 different levels of activation. The highest one means that we call all of our resources to be available. So we have anesthesia, operating room, the blood team, we have nursing, and we also have physicians and medical students as well, in addition to pharmacy. So we have a very big team that will respond. When a patient comes in, we're alerted that they're here, and then we assess them from head to toe to determine what issues they have and what is life-threatening, and control that first.
And when you're going through, kind of describe what you're seeing, the sign, and then you go into the room with the physicians, kind of
Sure.
that.
So the patient arrives with EMS at the ambulance bay. As the patient comes in, our trauma center is named after our founding father, Dr. Norman McSwain, who passed away about 10 years ago. And so we named the trauma center after him, and his name is right there as he comes in. And so we like to think Dr. McSwain is still here helping us to run these traumas. And so the patient is brought in. They typically come into room 4, which is a legacy that goes back to Charity Hospital. When the trauma center first opened in 1996, room 4 is where they would run all the traumas. So when we moved into this building, we kept that name. So all our patients typically go to room 4. They're initially brought in, EMS moves them over to the bed, and then we have a physician who starts a head-to-toe assessment. And so they start with their airway, breathing, circulation, disability, and extremities. And then we have a large group of about probably 10 to 12 people who are assessing them, documenting what injuries they have, and then we try to make a determination what we do next. If the patient needs to go to the operating room immediately, if the patient needs additional workup, if we need to control bleeding in the emergency room. But we have operating rooms available at all times, so that is what sets us apart from a lot of other hospitals, is that we don't need to have time to set up. The operating room is always ready to go. If the president's here, if we have a mass casualty, we're always ready to take our patients to the operating room. So usually the makeup is we have 2 people at least from the emergency room, a supervising physician and resident physician, and then we also have the surgery team, which is a trauma surgeon like myself, and then we have a trauma chief resident. We also have some other residents that will help, so other physicians that are still in training, medical students, nursing, pharmacy. We also will have radiology techs. And then we have a blood fridge here, but if we need additional blood, we call our blood bank and they can bring us additional blood products down. I mean, we deal with small mass casualty events. That's not something that is infrequent. So for us, if we get 5 or more patients at a time, we consider that a mass casualty. Obviously, what happened on the first was a much larger scale event, but we were ready for it. And so we were able to mobilize all of our resources. Being the only trauma center in New Orleans, we take care of the sickest patients. And so the sickest patients came here just because we have the people, the resources, and we were able to get those patients stabilized into surgery or wherever they needed to go. And then some of the outside hospitals that took other patients transferred them to us once things had kind of calmed down. What's really one of the very unique things about New Orleans is we use a lot of pre-hospital tourniquets, and that's something that had really started back when Dr. McSwain was alive, and he was one of the first people really in the world to recognize the value of it. And so New Orleans police and fire have all been trained how to place tourniquets, so they can initially stabilize the patient till EMS, is able to get safely to the patient. And I would just say we have really great EMS here. They're experienced. They know how to take care of really difficult scenes, and they're able to bring the patients here. And I think we have a great working relationship because they know where to bring the patients. EMS now has blood pre-hospital, which is something that is unique. Not all places in the country have it, and we really have seen a difference with at least even just a short transport time from Bourbon Street, patients getting blood. It will save their lives. I'd want people to take away that they know when they come here as a trauma patient, we'll take very good care of you. We know all the things to do to get you stabilized, to save your life. Dr. McSwain used to always say that death is your competitor, you fight to win. So that's how we approach everything, is that we're always fighting against death. We want you to go home, we want you to go back to your families, and we'll provide you with support along the way to get you there.